And I think there is a sense that Obamacare may implode. The fact that they're unable to meet the deadlines, the fact that businesses and consumers are increasingly up in arms about the provisions of it, and this is without wasting time on some other things that we could all list. So the question is, what do we do to replace? Well, one thing I've always advocated is to have something which is patient-centered as opposed to bureaucratically centered. And if you will, a cornerstone of being patient-centered would be something in which the patient is in control, a novel concept. Consumer-driven healthcare is something in which the patient is squarely in control, both of our health, but also of our pocketbook. John has been a leader on this long before I ever contemplated politics. I remember reading his stuff because I was contemplating public policy. And so for the last 20 years or so, he has been writing about these sorts of topics. Now, the importance of it is, let me quote here, there's a 2012 RAND study that if consumer-driven health plans grew to account for about half of employer-sponsored health insurance in the U.S., health costs would drop by about $57 billion annually, about 4% of the current health care spending for the non-elderly. We've also seen that it can work in the Medicaid population. In Indiana, they've instituted a Medicaid waiver program, which essentially uses health savings accounts. Again, they have seen that patients become more responsible for both their pocketbook and their health, with outcomes improving for both. So the question is, what could we do to make this the centerpiece of a replacement? With that said, I will invite John. John Goodman received a PhD in economics from Columbia University. He founded the National Center for Policy Analysis in 1983, and Wall Street Journal has called Dr. Goodman the father of health savings accounts. With that said, we appreciate his attendance here. I appreciate all of y'all being here, and I look forward to a very kind of engaging conversation.